Dental radiographic exams are one of the primary diagnostic tools to determine disease states and to formulate the appropriate treatment. Radiographs should be prescribed according to selection criteria guidelines. These guidelines are based on a variety of factors, including the patient's medical and dental history, clinical signs and symptoms of disease, risk factors, age and dentition, and new or recall status. Dental radiographs are valued diagnostic tools when the image quality is adequate enough for proper interpretation. To do this, it is imperative to correctly place the image receptor in the mouth and ensure that the primary X-ray beam is centered and aligned correctly in both the vertical and horizontal angulations. At this time, it is crucial to minimize patient exposure to radiation. Successful images require the use of careful technique and precautions to maximize their diagnostic and interpretive value. This video is provided by Dentsply Sirona and is to be used as a guide to enhance the clinician's skill in acquiring quality radiographs. This informational guide is not intended as a replacement for the Directions for Use manual for any product shown. Always check your manufacturer's guidelines for recommended use of equipment. The bisecting angle technique is an alternate approach for periapical radiography. With this technique, the receptor is placed diagonal to the long axis plane of the teeth. The beam is then directed at a right angle to a plane that is midway between the receptor and the teeth. This method produces less optimal images because the receptor and teeth are not in the same vertical plane. However, it is a useful method when ideal receptor placement cannot be achieved due to anatomical obstacles or placement difficulties. This technique is more operator sensitive. If the angle is not correctly divided, elongation or foreshortening will occur. A variety of holders can be used for accurate positioning of the receptor in different locations in the mouth. Technique adaptations may be required due to anatomical considerations or to avoid patient discomfort. These anatomical considerations include shallow palates, narrow arches, the presence of tori, and the loss of alveolar bone. Selecting the bisecting angle technique instead of the paralleling technique is useful in the case of shallow palates and gaggers, as well as high palatal vaults. The ComfortWand holder is an autoclavable holder indicated for both vertical and horizontal periapical imaging where there is limited room for a bite block, such as a pediatric or endodontic imaging. The soft elastic strap cushions the hard corners of the sensor and secures size 1, 1.5, and size 2 sensors, while the recessed slot in the handle tames the sensor cord. Place a RINN sensor cover over the digital sensor. Insert the corner of the sensor into the ComfortWand holder. Cover the edges of the sensor with the plastic strap to secure the sensor. Position the holder in the patient's mouth and have the patient hold the ComfortWand holder in place. Align the PID and the image is ready for exposure. Position the holder in the patient's mouth and have the patient or parent hold the ComfortWand holder in place. Align the PID and the image is ready for capture. Thank you for viewing this instructional educational video brought to you by Dentsply Sirona.